900,000. That is how many hip and knee replacements people have in the U.S. every year.
And News 13's Victoria Dunkel is live at Party Hospital to show us what is driving those numbers and the technology making it easier on the patients. Good morning, Victoria.
Good morning. Well, here we are in the surgical ward, and in just a few hours, there's going to be someone in here having a hip or a knee replaced. And the numbers of cases are actually growing at an incredible rate. It's partly because the baby boomers are reaching 65 at an average of 8,000 baby boomers a day. Also seeing some of those baby boomers and other people who are in need of new joints for their hips and their knees. And you are talking about how this is going to be growing. This is a field that's going to grow at an incredible rate.
Well, right now, Victoria, I'm doing about one a day.
Wow.
But the first baby boomer reached 65 years of age in 2011. So there is an upcoming epidemic of people who are going to have joint replacements.
Well, this morning we've been looking at the problem, and this time around you're going to kind of walk us through to the point where we can solve the problem, what you do every day. So how do we get to the point where we're regaining our freedom and our quality of life?
All right, Victoria, I promised I'd show you how to fix this problem. Here's the problem, as you recall. The problem is in a normal joint, there's cartilage that covers the ball and the socket, but here is a hip where there is no cartilage. Now, you remember our ball that had no cartilage? This is actually a hip ball with cartilage, and here, no cartilage at all.
Okay.
If you look at our x-ray, you can see a ball where there is cartilage and a ball where there's no cartilage at all.
So how do we fix it? How do we get that feeling better?
Well, you know what? An automobile mechanic would probably make a very good orthopedic surgeon because this is all mechanical and it just makes good old common sense.
Okay.
The problem is loss of the cartilage, so the solution is simply to replace that lost cartilage. And it's replaced with metal and plastic.
Interesting.
So here's the metal ball, here's the plastic bearing, and that is a modern joint replacement.
And we're talking about amazing recovery rates on this, too, the way things have changed even from the earliest joint replacements to today. Someone comes in and gets a full hip replacement today. How soon will he or she be leaving the hospital?
They'll be leaving the hospital in about 3 days. You know, when we first started doing this, people were in traction for 3 weeks. Now we can do it without going through any muscles or tendons. The new minimally invasive anterior approach to the hip has made it so that people frequently will go straight to a cane and not even use a walker at all.
Incredible hope for those of us who are watching either ourselves reach that point in our lives or our parents, and because no matter what we do, the longer we live, the more wear and tear we put on our joints. Coming up, we're going to take a look at some of the other innovations that are really helping make this aspect of an epidemic of joint replacements becoming something that is actually something patients can live with. Reporting live in Hendersonville, Victoria Dunkel News.